I'm excited to introduce you to Choice in Aging, my absolute very favorite nonprofit organization with a beautiful long history of serving people with disabilities, enabling them to continue living in their setting of choice with the support they need. In addition to the ones she covered, which were adult day healthcare, also called community-based adult services, the Multipurpose Senior Services Program, and California Community Transition, we also provide services that we choreographed and created out of the needs that we saw with the families we were serving. So we created an intergenerational preschool that connects with our adult day healthcare program, busting ageism and ableism before they can take root. We created a mental health care management and education program, a specialized door-through-door transportation program, and a bunch of advocacy and policy work with that. Caregiver support and education, and we do a lot of policy and budget advocacy. We have to because we live in a society that is ageist and ableist, meaning if we have disabilities or are aging, there are some serious barriers to us getting what we need. And that is where the wonderful master plan for aging that Sarah mentioned is so important. Building off of all of the services we have covered so far and getting us to where we are in a place where we are sufficiently funding these programs and where we include thinking about aging and disability needs when we plan things like parks, housing, healthcare systems, transportation, and more. At this moment in time, we are trying to build aging and disability into an already built system that wasn't built for us. So we're working on two tracks. One is to fix the existing world around us as we build, and the other is to create better places and spaces for ourselves and our children and future generations. So how do you know what is available to you where you live? Thankfully, that's easy. You call 800-510-2020 and ask. Each of those 33 planning areas have an area agency on aging that receives funding to ensure you have access to the services where you live. These services include transportation, nutrition, caregiver support, respite, legal services, help navigating, and more. And if you are living in a boarding care or group home or assisted living or skilled nursing facility, there is a local long-term ombudsman that is your advocate. They will ensure your needs related to living and care are their top priority. You have rights. Always remember that. And if you're over 60, those services are for you regardless of income. Today, we are seeing a great number of inquiries about housing subsidies, eviction protections, but they can also help in so many more ways with elder abuse, education, advocacy with Social Security, supplemental security income, Medicare, Medi-Cal, discrimination, and the list goes on. As Sarah mentioned, Meals on Wheels has a variety of nutrition programs, but more and more these programs are expanding their services and offering support like fall prevention classes, fall prevention assessments in the home, friendly visitor calls, and in-home visits. Don't forget your information and assistance at 800-510-2020. They can connect you. These are my people. These are the people who work in and attend community-based adult services, and some who also get support through the Multipurpose Senior Services programs. These programs are all about getting to know you, your desires in life, and helping you achieve your best life. We do that with puppies and painting and music and gardening. We do that by creating opportunities to build friendships and work on our goals, whether through exercise classes or working with our physical therapist to increase strength and prevent falls, or meeting with our dietitian to create an eating plan that allows you to feel better and do more. We do fun stuff like have a carnival day, Halloween costume contest, live music performances, and intergenerational balloon volleyball. We help ensure you can get to and from doctor's appointments, grocery stores, and can connect you to things like mobile faith-based services. While there are regulatory limits as to what we can do, we oftentimes don't let that stop us. Shh, don't tell the state. We are your partners in living your best life. And just because we are aging doesn't mean we cannot have joy in our lives. The world is not always kind to people with developmental and intellectual disabilities. But if you tap into the incredible network of aging services, as have been outlined today, I hope you will find the joy we have in working in this space.